Thank you for joining us. It's a pleasure to have you here. I'm going to give a couple seconds for people to connect their audio. Feel free to that is coming up. You guys can get access to this for a whole year of content with interviews, exclusive opportunities. If you sign up, generally this is about $50. However, we have partnered with them and gotten the price down to $29. So if you guys are interested in participating, use our code. You can find this on our link tree in our Instagram bio. And then if you guys use our code, pre-health shadowing actually gets 50% of the cut. So this is an amazing opportunity for you guys to get something out of it and for pre-health shadowing to keep our website up so the quiz does not crash when everyone is taking it. Alrighty. So we have another free opportunity. Guys, we are loading you up right now. I'm so excited for this. So if you guys are studying or will be studying shortly for the MCAT, you must know that MCAT prep is super expensive, and Kaplan is actually partnering with us where you guys can submit your emails into our form, and you guys will actually get free study guides and resources. So if you guys are interested, it's completely free. All you have to do is send your email to us, and you'll get a 10% off coupon code to any Kaplan course, as well as all of these free study guides. So if you guys are interested in getting your free study guide, be sure to click the link that is in the chat. We will have upcoming scholarship opportunities with Kaplan, so you guys can actually win a $2,500 Kaplan course. We will have more information on this on our social media, so be sure to be following us on Instagram at Pre-Health Shadowing. If you are interested in getting published on the official Pre-Health Shadowing website, we do have some opportunities for you as well. You can now submit articles, reflections, reviews, and success stories all to the Pre-Health Shadowing website, where it will be checked by our editor-in-chief, who will send back some thoughtful revisions and insight. So if you guys are interested in submitting, you guys can only do this by accessing it through the URL. So you have to type in www.prehealthshadowing.com/blog-submissions. Be sure to write this down if you are interested in participating in this, as you cannot access it from the main menu on our website. So completely exclusive opportunity if you are joining us today. Yeah. Also, we are starting a student podcast. So if you are interested in being on our podcast team, our team member, Anthony Castillo, who is in our chat today, Anthony, if you want to give us a little wave, is starting a podcast. And so you guys can join our student team. You can interview with Anthony and potentially, you know, be a co-host. You could potentially be the editor, the director. That's pretty awesome. So I welcome you now to please pull out your cell phones and go to the camera. On the camera, what you can do is scan your computer screen, and it is going to bring you to a page on our website. This page is our donate page. So Pre-Health Shadowing, like I said, is a student-based, student-led nonprofit organization, and we survive solely off of the contributions of our community. As we are providing these free opportunities for you, we do ask that if you are able to please donate anywhere from $1 to $5 to $20, just to help us keep our website up. We do have some complications recently where our website has been shutting down due to the high load of students. And so, of course, we want to make this as accessible and flexible for students, so we will never charge you to join our shadowing sessions, but we do ask that if you are financially able to please contribute whatever you can. If you are not financially able at this time, we completely understand. We are all college students, I feel it. We just ask that you share this link with 5 people. So if everybody in this Zoom call today can share this link with 5 people, we would potentially have enough money to pay for our website for the next month, which is really awesome. It does get very pricey. If you are looking for a mentor, we do have a mentorship opportunity coming up. This is 100% virtual in observance of COVID-19. So we have a 3-day event. This will be from February 19 to 21, where you have the opportunity to meet with up to 2 established professionals per day for a total of 6 professionals. This is a wonderful opportunity to gain someone to kind of help you get through your process. You know, maybe it's the application process, maybe it's the residency process. You know, wherever you're at, someone's going to be there to talk to you about it, to guide you. And so this is actually by invitation only. So if you guys are interested in gaining an invitation, I'll tell you how. This is how. You are going to download the materials from our Google Drive. It's going to be 3 photos. Once you do that, you're going to want to go to our website, register as a volunteer, put your name, your email, submit, post those 3 photos on your social media. I also recommend putting a little personalized video or text or anything like that. And then once your bingo board is all filled up, you can submit it to the pre-health shadowing website, where you will then receive an RSVP invitation. It is that easy. Normally, this is $136, so you guys can fundraise this and come for free. We are making this accessible and flexible for students, so if you guys have any questions about this, feel free to email us at volunteers@prehealthshadowing.com. And there is more information on our website if you visit the Mentorship Bingo 1 slug. If you are interested in helping out with pre-health shadowing, we are a student-based organization. You can become a student volunteer by using the link medicalshadowing/volunteer, or you can also become a team member, which is a leadership role. If you guys are interested in either of those, I will talk more about it at the end. And if you're a high schooler, you can also get involved as well. So we do have a new program called HTP. You can apply through our general team member application. And HTP is working to establish pre-health shadowing as a club on various campuses around the US. So if you guys are interested in spreading the knowledge and you know, increasing diversity within the healthcare field, definitely check this out. If you are joining us for our live session today, go ahead and post on your social media how you are set up today. What is your note-taking strategy? Go ahead and post that and tag @prehealth shadowing for an opportunity to be posted on the official page. With pre-health shadowing, students can take a post-shadowing assessment to receive a certificate verifying their virtual shadowing hours with us today. So I encourage you guys to take good notes and to ask our professionals some wonderful questions. Feel free to drop those questions in the chat throughout the entire session. Members from our student team will be taking your questions and asking them during the Q&A portion. Alrighty, and without further ado, I would like to welcome to you our professional for today. We have the honor to be shadowing sorry, my screen is everywhere right now. My computer just shut down. Can you guys still hear me?
Yep,
yes? Oh, okay, you can still hear me. I'm gonna give you guys the floor. My screen just turned off and I have no idea what happened. Welcome, thank you for joining us.
All right, can you guys hear me?
Yes, screens look great too.
All right, okay. All right, everyone, thanks for having me. I really appreciate this opportunity. I mean, basically with everything I've seen so far, I'm so excited to be a part of what's going on. This is such a movement. And I just remember being an undergrad, you know, a pre-med student and not having an opportunity like this. I mean, just trying to get someone to listen and, you know, talk to me about what it's like to go into the medical profession was, I mean, it was a battle. So something like this is, it's actually beyond amazing how all you guys came together. I actually cannot wait to find out how this all came together because this is awesome. But once again, thanks for having me. And I mean, the title of this presentation is basically talking about my journey to maternal-fetal medicine. This presentation is not going to be about telling you guys, you know, how to study or about how to score very high in your MCAT or, you know, about how to get into the top programs. That's not what this is about. This, I hope at the end is going to be a kind of an inspirational talk so that those of you who are very passionate about taking care of people, about joining the healthcare community, especially seeing what COVID is doing to the world, you know, you guys can find some kind of strength and some kind of pride in what you're pursuing, and hopefully you do not give up. So without further ado, I will go ahead and get this process started. So why did I choose a career in healthcare? I was born in Nigeria, a country in West Africa, very well known. In 2001, my mom was selected to apply for something called the visa lottery. And it's a system that, unfortunately, recently, for political reasons, was eliminated. And it was a way of bringing people who are not, people from countries that are not well represented in the United States to get a chance to come to the United States with their family. So my mom happened to be selected through this program, and we moved the whole family, my siblings and I, my dad, all moved to a beautiful city of Bronx, New York. For those of you who know Bronx, New York, one of the things the Bronx is known for is the Bronx Zoo. And I put up these two pictures just to show the two worlds that I've had to live in. I've spent basically half my life in Nigeria, and then the other half has been here in the United States. We moved to Bronx, New York, March of 2002. And I remember just being perplexed. The culture shock, the difference from where I was coming from to my new home was all, it was quite invigorating, but at the same time, kind of shocking, just because everything was different. Everyone I knew my whole life was not there anymore, and I had to start all over again. Now, I put up that picture of the Bronx Zoo as well, because that was also my first summer job when I moved to the US. I remember being so excited because the job was, the title of the job was that I was going to be an ornithologist trainee. So it sounded so fancy. But I actually ended up being us picking out the trash around the Bronx Zoo. But it was quite humbling, and definitely a beginning of many amazing things to happen in my life. Now, part of my whole movement into healthcare and deciding to become a physician started in Nigeria. Obviously, all the life experiences that I saw growing up ultimately became a motivation. Growing up there, I always tell people now that I work with, when a woman is about to have a baby in the US, there's all this celebration, right? There's a gender reveal party, there's a baby shower. Even when when the mom has the baby, now the new things I'm hearing are things like push gifts. So when you see the culture surrounding having a baby in the US, it's surrounded by a lot of celebration. Something is always being celebrated. Which is quite opposite, where I grew up, where when someone becomes pregnant, people are excited for you, but at the same time, people are kind of scared because there's this concern that, is mom going to make it through this pregnancy? And that's because of, some of the issues surrounding maternal mortality in that part of the world. And so when a woman is going to the hospital to have a baby, there's a lot of prayers going on behind the scene because people are worried, is she going to make it home? And even if she makes it home, is she going to make it back home with the baby? So it's no more just a conversation about celebrating this new life coming into the world, but also praying that the vessel carrying this new life also makes it back home. So it's a complex situation. So it's always fascinating to me when I see the, how birth is romanticized in the US culture. But it also called for me to want to be a part of the solution. And part of that solution started at Morris High School. So when I came to the US, I was I had about 3 months of 12th grade to complete it at the time. So I started at my neighborhood high school, which is Morris High School. Interesting fact, this is actually the high school where Colin Powell graduated from. But at the time when I was at Morris High School, it was also ranked one of the worst schools in the whole New York City system. And actually about 2 to 3 years after I graduated from this high school, it was shut down. And they divided it into 6 smaller schools. The neighborhood where we lived in the Bronx was a very, very poor neighborhood, not a lot of resources there. The families there, a lot of parents worked multiple jobs to keep things going. A lot of single parents household. So again, another culture shock for me, coming from a culture where there's a lot of 2 parents households. Education was key. That was the basis of all families. And then now I'm in this place where there was just so much devastation of families economically, socially, I mean, name it. I mean, the people I graduated with actually did not even know me because I only spent 3 months of high school with them. And on graduation day, a lot of them looked at me and they were like, who's this guy? We've never seen him before. But, that's all part of, partaking in a new journey. One thing the people in this high school did not know is that they molded what my life was going to be 17 years later. Some of the things I saw, some of the difficulties I saw among the students, among the homes they came from, health problems I saw. Bronx, New York is known to be one of the parts of the country that is devastated by asthma, childhood asthma, and such a big deal in that area. So I remember a lot of kids who walked around with inhalers, missed schools. So again, this was another part of a beginning of something big to come. Now, at the time when I came to Bronx, New York, you're talking about March. By March, I would imagine most students in the US already knew where they were going for college. But I had not even taken my SAT, and I felt quite strong that I definitely wanted to go to college that same year. And this was I was at the age of 16 when this was happening. A lot of people say they were like, basically that I should consider maybe taking a job, working for a year before applying to college. But I felt quite strong that I definitely wanted to go to college the same year because, I was graduating. People were concerned that I was taking the SAT late and that my chances of doing well was quite slim. But I still pursued it. And I took my SAT actually May of that year. Again, remember by May, most students know exactly where they're going for college. I found out my score around June, and I went ahead and I just applied. I ultimately heard back from only 2 schools. Most schools were like, oh, we already, you applied very late. The 2 schools I heard from was State University of New York at Purchase and State University of New York at Albany. So 2 state schools. I really wanted to go to Albany because I wanted to be very far from home and enjoy some of the college life I heard about. But I ultimately chose Purchase College, which was about, I'll say 35, 40 minutes away from home. And my parents wanted me to be close, obviously, because we are very new in a new country where we did not know too many people. So that led me to Purchase College. Again, one thing I would say is sometimes in life, and you guys are probably going to hear me say a couple motivational things during the length of this talk. But sometimes in life, we try to fight some things that happen to us because we think we know better. But when certain things are happening to you, it's okay to just kind of step back and just watch the process and learn from the process. Because when you try to take control of every situation, you end up kind of knocking yourself into the, towards the wrong direction. And, at first I was like not so happy that I was going to Purchase College. It was close to home. It was a very small college. I think we had a total of like 5,000 kids. But it turned out to be a blessing. A huge blessing. Purchase College, small college, liberal arts college. Actually, what we were known for was we were known for the arts. It was a big dance school, theater school, visual arts, name it. People were always shocked when they asked me what's my major, and I said I'm a biology major. They're like, oh, wow, I didn't know we had biology majors in Purchase. Just because it was a big, big theater program, but it was my first true introduction to the US, because at Purchase College, such a liberal arts college, I met people from all walks of life, coming from a country that it's kind of a little bit conservative. To go into Purchase College, it changed, it remolded me into who I am today. I was able to view the world in a much more bigger lens. I met people of all walks of life. I played soccer all my life growing up, and I was quick to be selected to join the soccer team in college. So that definitely helped with my social life. The other thing I loved about Purchase College was the small class sizes. I really wanted to go to a bigger school because I heard with a bigger school, you get to meet more people, blah, blah, blah. But the issues, sometimes with the bigger schools is that when you're in a bigger school, you have bigger classes. And with bigger classes, you kind of lose that connection with your professors, having that one-on-one time. But at Purchase College, for example, my biology class was, I think, like 60 something students. And this was like freshman year biology class. So you basically had a bunch of people who were not pre-med also taking the class. And I remember, the students in the class thinking, oh my God, there's a lot of people in the class. And I also remember having friends who were in the bigger schools who had about 300, sometimes 400 people in some of their classes. But it was a blessing in disguise because I got to actually know all my professors throughout my time in college. Every single professor I had, I actually was able to see them during office hours, spend some time with them, go over things that I did not understand. And it wasn't so much pressure compared to if I went to a much more bigger school where you were dealing with a lot of students and you might not necessarily get the attention of your professor. That was not the case at Purchase. I also loved Purchase College because it was very welcoming of everyone. So it was easy for me to incorporate myself into the system. I mentioned being in the soccer team. That was awesome because it was a Division III soccer team. And so it was helpful because ultimately deciding to go the pre-med route, we did not have a lot of travel games. So it did not affect my classes that much compared to if I was in a Division I. Again, something I remember being upset about in the beginning. I was like, I really want to be in the college where they had the kids on TV. But that was not the point. My destiny had something else in plan. Now, when I first came to Purchase College, I actually was not thinking of being a biology major. I actually wanted to be a math major. And the reason was because I never was one of those kids who wanted to be a physician in the beginning. My decision to become a physician actually happened in the third year of college. I actually wanted to be an engineer. But when I saw that the math program at Purchase was quite small, and it was not ultimately going to lead to what I was interested in, that was when I ultimately declared a major my second year. But I ended up taking a lot of classes that was going to lead towards pre-med without knowing it. My first interaction and ultimately deciding that I think I should switch to pre-med came the summer after second year of college. I had an opportunity given to me by a lady I'll never forget in my life, Dr. Lynn Holden. She started a program called Clinical Mentoring and Exposure Program, where basically she had kids in inner city New York who were interested in the medical field come shadow at Jacobi Hospital and Montefiore Hospital in Bronx, New York, to basically see what it's like working in the emergency room, and through that, hopefully be inspired to pick something in healthcare. So I actually happened to be the first of her students who did this program. I remember going online, just searching to see what I was going to do for that summer. And there were two things I signed up for that summer. One was her program, her 6 weeks program. And the other thing I signed up for was a 1-month internship in New York College of Optometry. So I did her program, and that was life-changing. I worked mostly at the Montefiore Hospital emergency room, and I spent most of my time actually just giving pillows to patients, getting water for them, making the beds, doing like the basic things. But I also had the opportunities of interacting with a lot of the emergency room physicians, and just talking to them all the time, seeing what they did, seeing how they took care of people who looked like me, made a big difference in their lives. And right there, that was it. That was the spark I needed. And I remember finishing that rotation, the 6 weeks rotation, and then doing my New York College of Optometry internship, and I never turned back. I went back to college. I declared pre-med major. I was definitely for sure I was going to be a biology major at this time. And I remember saying to myself, this is it. I'm going to get very serious about this. I'm going to get very focused about this, and I'm going to do this. At that time, I think someone joined us earlier and said that they were just coming out of an organic chemistry class. And I remember knowing that I was going to take organic chemistry, and man, was I scared. But I knew I had no other option but just to get on the grind and make the best of that class. You see, you guys have probably heard this. There's going to be a lot of classes you're going to take in undergrad that will have absolutely nothing to do with you becoming a physician. There's also going to be a lot of classes that you're going to take that is not going to determine what kind of physician or what kind of medical provider you're going to be. There's a lot of people who I started with in freshman year who they knew for sure coming in that they wanted to be physicians or some kind of a health professional, but they ultimately changed their mind after they had, some difficulty with some of the classes, which was unfortunate because later in life I realized that not doing so well in one class or two classes or three classes, I mean, you guys have heard all the stories. It's not ultimately going to, decide who you are going to be as a healthcare provider. I've met different people in this profession who, I mean, I could not believe, how they finally made it into here. But these are some of the most phenomenal healthcare providers there are today. But that's because they had the passion. So I say this to say, do not let organic chemistry, do not let physics, do not let whatever it is, chemistry, analytical chemistry, name it, biochemistry, whatever it is, be the decision maker for what you want to do. Your passion, okay? And people who know me very well know that I constantly speak on passion. If you are passionate about this stuff, okay, let's put the money to the side, because there's a lot of student loans that comes with this stuff. So let's put all the fancy stuff to the side. If you're very passionate about taking care of people, if you do not mind spending evenings in the hospital because your patients need you and you want to be there for them, you're gonna make it, okay? And I'm telling you, you're gonna make it because the passion you have to really pursue that stuff is gonna be so strong that people are gonna look past whatever those difficulties you had in organic chem or name it, whatever class it is. They're going to look past that to say, this is definitely a guy or girl that we could see being our colleague in future and who can make a difference in healthcare field. So just be aware of that. Anyway, I ultimately wrapped up third year of undergrad. And my third year was definitely, once I made that decision that this is definitely what I wanted to do, my third year was hands down, one of the best years I've had in the 3 years. Made Deansley's the 2 years right after, at this point I was like, okay, definitely I want to do the medical school thing. The thing is, I actually did not have a lot of mentors when it came, just kind of having a one-on-one time. Dr. Lingho, she was a very good mentor, but she was also a mentor to several people. But I did not have like that person who was just like one-on-one with me. And so I really did not know what it was going to take to, make it into medical school. So I remember a friend of mine who had signed up for Kaplan. And again, I don't even know what's popular now with like MCAT study. I don't even know if when I was trying to apply to medical school, Kaplan was the popular thing to do. But I don't know what's popular now. But I remember a friend of mine he paid for the Kaplan course. And during the time I was like, hey man, do you mind if I just get some of the books and just kind of go over it if I take the exam? But by the way, and this is a lot of ignorance, right, in talking about this, because at the time I did not know how much you had to study for the thing. I did not know what amount of work you had to put in. I did not know all of that stuff. So it really took me, I would say, and this is real story, 2 weeks. 2 weeks of just flipping over through the notes my friend had taken during the Kaplan course to finally say, oh, I think I could take this stuff. And I went and took the exam. And obviously I was not ready, because I remember going to the exam, I was like, oh my God, what is this? I did not take any course, I did not study much. It was just the notes he took from the course that I read. I finally got my score, and me, again, just not knowing exactly what the average scores were, anything like that, I went ahead and I applied to 10 schools. The reason I applied to only 10 schools were because I applied for the financial aid program that they were given. Again, I don't know if this still exists. It's called, we called it FAP then. I was able to get 10 school applications covered for, and I applied only to 10 schools. That was it. I heard people apply to way more now. But with the 10 schools I applied to, I heard back from 2 places. One of the places I heard back from was actually Albert Einstein College of Medicine. The thing about Einstein College of Medicine is that during my 4th year, I actually did a summer research program with them. So I will say they probably just gave me that interview just to be nice to me because I did a summer research, not because my MCAT, definitely bought me an interview with them, but they gave it to me. I was there for a summer internship. And then the other place was Upstate Medical University. At Albert Einstein, I went for my interview. I could tell, I was like, I'm probably not going to end up here. You just feel the vibe. The vibe definitely was missing that day. Then I went to the Upstate Medical University interview. It was a little different. I felt like they were like, you did well in undergrad. Your GPA is good. Your MCAT score is just not that great. But we really like you. We just think you have potential. Your personal statement was excellent. Again, this is why I say to you guys, don't get too caught up. You want to do well in school. And you're going to see this. I mean, you want to definitely be a very good student. No question about that. But at the same time, make sure that your life has more substance than just grades. Make sure that you're a complete person, right? Make sure that you have other stories that go beyond just being the student that gets all A's. Okay, because people will appreciate you more if your stories goes a little deeper than just this person who gets up every morning, goes to class, does their thing. Like, have more, add more to your life, add more to your story, add more to this adventure. Just think about that. But I felt like that helped me. I had done a lot in college. I was involved with a lot. Just my life, living in a different country, the experiences there, I think all of those things added to my story, and they really appreciated that. So they said, well, you're going to hear from us. We'll find out. So I graduated college. I didn't have much going on. I was trying to apply for this forensics job. My dad was giving me hell every single day, reminding me I was not going to med school. What's my plan for my life? You guys know how parents are. Just nagging me every day. I was trying to figure it out. At the point, I was like, you know what? I think I was considering going to the optometry school because they really told me, they said, hey, listen, man, if you just take the optometry exam, I think it's called OAT. I cannot remember. I think that's what it's called. Excuse me. Sorry about that. So I think it's called the OAT. But they told me, they said, hey, all you have to do, your GPA looks great. Just take the exam, score this score, you'll get it. But I liked the optometry setup, but I kind of knew that I kind of wanted to go towards the healthcare field through a different path. So, but then at that point, I started rethinking. I was like, maybe I should just consider going to optometry school. So before I made that application, I just decided to make one phone call. So I called the admissions director at Upstate Medical University. By the way, Upstate Medical University is in Syracuse, New York. I decided to call them. So I called them. I said, hey, by the way, I don't know if you guys remember me, but I interviewed. I've not heard back. I'm just calling just to see, did you reject me, or you just didn't care to give me a call back? And this was funny. They said, oh my God, we have been trying to call you. What's going on? We've been trying to reach you. We actually started a master's program in medical technology, where students we feel have a lot of potential could go through this master's program, and it's a 2-year program. And even if they are not able to, retake their MCAT and score higher, they at least have a career in medical technology. I was like, oh, what's medical technology about? They told me. I was like, sure. I was like, but how long have you been calling me? They're like, we have been calling you for several weeks. I was like, but I've had my phone. What happened? Guys, it turned out that I had one phone number wrong on my application. I mean, I still think about this, and I do not know how this happened. But again, this is all part of destiny. And that's why I say when things are happening sometimes, don't fight it too much, because you're going to see how this all played out later. And so they said, actually, the day I called them, that they were considering offering the position to someone 2 days later. So if I had not called that particular day, I would probably not be here talking to you guys. So I was like, I accept the position. I cannot live with my dad anymore. I need to leave this house. When can I start? They're like, actually, classes start 3 weeks from now. And I remember saying, great, where is Syracuse, New York, compared to New York City and all these places? Now I really have to live here. Like, this is real. So I packed up, I bought a car, and 3 weeks later, I was in upstate New York at Upstate Medical University. I started the master's program. And I mean, the master's program, I have to say, I went in there knowing that I was gonna just be the best I could be. I went in there, no distractions, just ready to just give it my all and do as well as anyone can do. And that's what I did. After the first year of the program, we took my MCAT, scored high, and the school basically, the medical school, because Upstate Medical University, they also have a medical school. I would imagine a lot of you guys know this, especially those from New York. And they gave me conditional acceptance already after the first year of the program into the medical school, gave me scholarship. But my dreams, especially now knowing that my grades are excellent, knowing that my scores are higher, I was like, you know what, I actually want to go back to New York City. And my dream school has always been Albert Einstein, which is in, Bronx, New York, which is home for me. So at this time, I was like, I'm just going to reapply. So I reapplied again. Guess how many schools? 10 schools, because I get the financial assistance program. This time with the 10 schools I applied, I got 8 interviews. I went to 4 interviews. And once I heard back immediately from Albert Einstein, I canceled the rest of the interviews. That was it. That was my dream school. Now, at Albert Einstein College of Medicine, I was home, right? I was finally here, we made it, right? Started from the bottom. Now we really got here. And I thought it was over. I said, my whole dreams, everything I worked for, we're finally here. Let's get this thing going. Medical school, completely different business. I came into medical school, first, remember I told you when I started college, I was 16. By the time I graduated college, I was 20. So the 2 years of the master's, I came out at, age 22. And I remember starting medical school and saying, God, thank you, I did not get into medical school the first time that I had applied, because I was so immature that I probably would have gone in there and failed out right away. I felt like the master's that I did helped me. Now, I'm not saying this to say everyone should do a master's. I don't think so. My sister is my younger sister is a neurologist now, and she graduated at 20 from college and went straight into medical school. She's done excellent. She's brilliant. She does well. I'm just saying in my situation, it worked out perfectly well, because I felt like the 2 years of master's, I was able to hone in my skills of studying, and I was able to come out just a different person academically. So going into medical school, I remember just being appreciative of the fact that I had to go through the 2 years of the master's, because it kind of prepared me to face what I was about to see in medical school. Now, I'll just take a real quick pause about going to medical school. Not everyone is going to be a doctor, okay? We have physician assistants, we have nurses, we have nurse practitioners, we have nurse anesthesiologists, we have optometrists, we have chiropractors, we have podiatrists, we have dentists, we have different versions of dentistry. We could go on, we have cardiac perfusionists, name it. There are so many people that work in hospital. And this is me 17 years later, or actually 18 years later now, telling you this, right? There's this, a lot of us get caught up with, every single one of us trying to jump into the path of MD. MD or DO, right? Same thing. And the truth is, you always got to ask yourself the question of, why am I doing this, right? What am I trying to get out of this? What am I trying to bring to this? How am I going to make this different than what it looks like going into it? I say this to say I'm going to have the same exact conversation. I have 3 girls now. I'm a girl dad, proud girl dad. And, I say this to say I'm going to say exactly the same thing to my girls. If any one of them decides to go the medical field route, I'm going to say to them, ask yourself, what do you really want to do? Why do you want to do it? Because all the stories are exciting and all that stuff. But if it really comes down to it and you're like, you know what, I could still play the same role, contribute to the lives of people medically without going through the whole journey. That Dr. Nwabuobi went through, I will still do it. Now, some of the things we want to achieve, we can only do it through going via the MD route. But I just want you guys to not get caught up with the, don't get caught up with the hype. Medicine, being a physician, it's one of the best things that ever happened to me in my life. I can never take that back. But I'm just saying, you need to ask yourself the question, just because there are so many things in the healthcare field that you could, COVID-19 has been interesting because it has, shone light on so many other specialties people did not know about. Like a lot of people did not know about respiratory therapists until COVID happened. And they saw what great roles these people played in the healthcare system, in the ICU, with managing airways, and et cetera, et cetera. So I just wanted to put that plug in real quick, that this story, my story, is not about you becoming a physician. It's just a story of, you pursuing your goals in life, being passionate about what you want, and, hopefully everything all comes together for you. Anyway, but Einstein was amazing. Those of you who might be applying to medical school soon, in the very near future, I personally think it's one of the best medical schools. I mean, it is highly ranked, but on a more serious note, it's a great medical school because it's in Bronx, New York. It's in the heart of the Bronx. Again, like I said in the beginning, Bronx, New York is a very tough place to live. Not a lot of people with money. A lot of immigrants, working class people who are trying to make ends meet. So it's a hospital that takes care of the community. It's a hospital that's invested in the community. Very socially aware, socially focused. I mean, it was one of the best decisions I made because I had another school that actually was offering me a full scholarship, but I decided to go here. And I did get partial scholarship going to Einstein, but I just knew Einstein had something that it represented that I would not get in the other institution. And so, I ultimately went with Einstein, and it molded me into who I am. First summer after medical school, I spent my summer at Memorial Sloan Kettering. When I came into medical school, if you asked me what I wanted to do, I actually was thinking that I wanted to be a reproductive endocrinologist, an infertility doctor, which when I then found out, I was like, okay, so how do you become an infertility doctor? They said, oh, you have to go through obstetrics and gynecology. And then I was like, oh, no, I'm not doing it. I'm going to find something else. I do not want to do OBGYN. So funny enough, when I applied for the summer research program, I found out that actually that with, applying for the summer research, you have to apply for different specialties, rank them 1, 2, 3. And so I ranked gynecology, oncology research as my number 2. My number 1 was urology. I wanted to do like prostate cancer research just because it was, very, there was kind of an uptick around that time in African-American male, and still is today. So I was like, I want to do this research and see if this leads me to my career. And I did not get into the urology research. Instead, I got my number 2, which was gynecology oncology. How do you do gynecology oncology? You got to do obstetrics and gynecology residency. I was like, why do I keep falling into this? But anyway, I did that summer research again. Another amazing experience. I mean, I couldn't ask for anything. So if you guys see a pattern of my story, I always wish for some things, but I get steered a different way that ultimately works out. After that, I came back. I said, you know what? I know exactly what I want to do. I want to do emergency medicine. I'm going to be an emergency room doctor. That's what inspired me to go to medical school, blah, blah, blah. Third year is when you start your rotations. I started my rotation in third year, and during my rotations in third year, I realized I actually did not like emergency medicine. That what I liked about emergency medicine was that it was shift work, and I thought all the ER docs was so cool. They are always telling me about their stories, about going on some adventure somewhere. They stack up their shifts, and like, I mean, they were living their best life every day. I wanted to be like those guys. But when I realized I did not want to see the codes, the sniffles and all that stuff in the emergency room, and it did not look like all the TV shows with all the action all the time, I was like, I don't know, I'm not enjoying this that much. Ultimately, OBGYN was my second to last rotation. And I remember starting that rotation and told my wife, who was my girlfriend at the time. My wife and I, we met right before I started medical school. So she kind of saw me go through the whole process. And I remember telling her, I was like, I kind of like OBGYN. She's like, really? She's like, oh my God, that's amazing. She loved her OBGYN doctor and thought he was like the best doctor ever. So she's like, oh man, like you should look into it more. What I loved about OB was the combination of different things. So one second, I was in the room delivering a baby with the midwives. The next second, they call in the emergency room that we have a woman coming in with pain, and she just found out she's pregnant, and now you're ruling out ectopic pregnancy. Before you know it, you might actually have to take them to the operating room and take care of that. The next second, you're doing a C-section. There was so much variety. Now, when you're in the office, there's also a variety of like managing pregnancy, et cetera, et cetera. So I just love the combination. I love the energy. I love the fast pace. I hate sitting in one place and reading charts or looking at labs. I love action. So I was like, this is great. And taking it back to the initial slide I had, it took me back to growing up in Nigeria and remembering all those moms, even my mom, when she was about to have my brother, that fear, the maternal mortality concern that always comes up. I was like, you know what? This kind of is adding up together, but I have to go do what we call a sub-I. So sub-I is like a sub-internship if you're interested in a specialty and you want to go do an extra rotation and that stuff during your final year, just to, one, to be sure you really want to do it, and two, to kind of impress the people so that you get good letters of recommendation for your application. I did that. It went so well. It was just, everything was just so natural to me with OB. I got honors during the rotations, all my sub-I, it just fit nicely. And obviously, you have to apply for residency spots and interviews and all that stuff. And, that takes me. I remember when I left Syracuse, New York, I said I would never go back to upstate New York. But guess what? When I interviewed for programs, my favorite program for OBGYN residency was University of Rochester. And guess where it was? Upstate New York. So here I was dragging myself back to the snow and to the cold. But man, I loved this program so much during my interview that I ranked them one. And thank God, I matched into my number one program. And, obstetrics and gynecology training is probably one of the roughest residency training you could have. The other specialties I'll probably rank with us is probably neurosurgery and general surgery. I think general surgery is pretty bad as well. So, but OBGYN residency is pretty tough, right? It's 4 years of residency. It's busy every single day. It's surgical, it's medical, it's everything. It's a combo of it all. You are constantly, being the demand from you. It's very huge. So I figured if I'm gonna go into a specialty that is gonna be very, very difficult, I might as well go to a place where I love. And I really love this program, and it was everything. People always say OBGYN. So OB obviously is obstetrics. Okay, that deals with pregnancy and everything surrounding pregnancy. GYN is gynecology. So that just deals with women's reproductive tract, mostly when you are not pregnant. So gynecology, you already know women with abnormal uterine bleeding. You're talking about people with like adnexal mass, so like cysts in their ovary, endometriosis, different kind of pelvic pain, contraception, name it. I mean, the specialty is very diverse. I mean, there's been conversations about dividing it into two specialties just because it's so broad, how much stuff you have to learn in the two. Now, during residency, I fell in love with high-risk pregnancy. And OBGYN residency, as you can see here, is 4 years. I fell in love with high-risk pregnancy. I noticed that when other people were pissed off about a really sick mom who has to go to the ICU and stuff. I was so excited. I was like, okay, so what are we doing next? When are we sending them over? What are the labs we need to draw? Are they getting on the vent? All these things got me up pumped. I love the action. And during my third year was when I made the final decision. At this time, my girlfriend when I was in medical school is now my wife. And we had our first girl. And so I had to have the conversation with her. And by this time, my wife, she was now a nurse. She decided she was in public health for many years in the Bronx doing HIV research. So she decided to, when we moved to Rochester, she decided to go back to school again and get a second degree in nursing. So now she's a nurse. So we had to have the conversation. I said, actually, I'm thinking of doing the Maternal-Fetal Medicine fellowship. Now, OBGYN as a residency has multiple fellowships you can apply. Most people do a 4-year residency in obstetrics and gynecology and they come out and they start working. That's standard. But then there's a 25% of us who are crazy and decide we want to go spend more of our lives not making money and instead do more training. And so the options you have are reproductive endocrinology and infertility. These are the doctors who take care of women who have fertility issues and women who have like endocrinology issues. You were talking about gynecology, oncology. These are like the surgeons. They operate on every kind of cancer surgery of the reproductive tract. Pelvic and reconstructive surgeons. So you're talking about like women who have like bladder issues, bowel issues, incontinence, et cetera, they go spend a fellowship doing this. Then you have minimal invasive surgery. They want to just operate laparoscopically. Then you have family planning. These are women who are focused on contraception and abortion care. Then you have a new subspecialty called pediatric and adolescent gynecology. So they focus on taking care of that population, their surgeries, their care, name it, whatever it is. And then, of course, you have the best fellowship, right? I'm not being biased, but maternal-fetal medicine, where you become the person who is focused on managing any kind of complication that comes with pregnancy. So think about it, right? Think about your patients who basically have a heart problem, right? Who had a heart surgery when they were a baby. Now they are grown, they're about to have a baby. That's me. Just think about any medical complication, a woman who is on dialysis, who just had a transplant, name it. Just throw pregnancy into it, maternal-fetal medicine at the doctors. It's maternal, it's fetal, it's medicine. So we take care of every maternal complication. We take care of every fetal complication, okay, in pregnancy. So something that made it very fascinating for me. I loved managing those group of patients. I enjoyed the material and I said, you know what, I'm going to apply for it. The thing about obstetrics and gynecology fellowships, obstetrics and gynecology it's a competitive specialty, not as competitive as, let's say, orthopedics or plastic surgery or dermatology, but it is definitely on the competitive list. However, the fellowships are ridiculously competitive because now, and the match rates for the OBGYN fellowships, usually about, like for my specialty, maternal-fetal medicine, it's about like 59% the year I applied, okay, match rate. And that's because a lot of, the few hospitals that even have the fellowships take only one person a year. So I knew I had to do what I had to do. And I took care of business and I got into my #1 fellowship, again, gratefully. Now at the fellowship, this fellowship, working at Tampa General, I don't know if anyone here is from Florida, but Tampa General, I think, is probably one of the most busiest hospitals I've worked in my life. It had some of the sickest patients I have seen in my life. Some of them, it's an 1,100 bed hospital. It's massive. It's on an island by itself. I still don't know why anyone built a hospital on an island in Florida. But anyway, that was a question I had while I was there. But the training there was phenomenal. I saw it all. I did it all. So without further ado, I'll just put you guys through a case. This was towards the end of my fellowship. One of the reasons I loved the program I went to was because at Tampa General, we're one of the few centers in the country that had a fetal surgery program. So this was a picture taken of a team of us who did a procedure called an exit procedure, where basically you try to deliver a baby that has some kind of mass or some kind of either mass by the neck and the mouth, something that can affect or compromise the baby's airway. So you try to deliver just the baby's head to secure the airway before you deliver the rest of the baby. So meaning you deliver just the baby's head, you secure the airway by intubation, or even in some very rare cases, tracheostomy. Secure the airway, and then you could cut the cord and then deliver the rest of the baby and send the baby off to NICU where they could manage the baby. So this particular case was a case of a baby that had a mass in the mouth, okay? Ultimately was attached to the tongue. It was first diagnosed with ultrasound, which is a big part of maternal-fetal medicine. We are basically the radiologists of OBGYN. We read a lot of, we read all the images that have to do with pregnancy. So it was diagnosed then it was followed up with an MRI, which confirmed that it was actually occluding the vocal cavity. And then ultimately this decision was made. So right here, obviously it's me. This was our fetal nurse coordinator. This is one of my attendants, one of my favorite attendants, Dr. Obi-chan. This is the pediatric surgeon in chief of Tampa General. This is one of my favorite neonatologists. Whenever he's on, I know we're gonna be taking care of business. He's awesome. And this is one of our fetal nurses as well in the OR. So, so for this case, this takes a lot of coordination because you want everyone to be at the right place at the right time. So you have a team. So right here is the pediatric surgeon waiting. This is me. This is my maternal-fetal medicine attendant. I was a chief fellow at this time. So that means basically you're in your final year of fellowship. So it's a 3-year fellowship. So this was my 3rd year. So remember, I did 4 years residency and then 3 years fellowship. So this was my 7th year of training at this point. So basically, and at the back is a team of anesthesiologists back there, right? And then you have our surgical tech. Okay, pediatric surgery also has their surgical tech team. This is the neonatologist. This is another scrub tech, and I'll show you more pictures. This is a setup. You can see all the ET tubes for the baby that they haven't. This is not even our setup. This is the general pediatric surgery setup right here, in case they had to try to operate immediately. This is the NICU team over here. So you can see we have a whole lot of people in this operating room just ready for this baby. And then I start the case, and it's being projected on the screen behind right there. Again, that's the pediatric surgeon, that's the neonatologist, just waiting and watching everything. The special thing about this case is you want to find a way to get this baby out without the uterus bleeding a lot. Because if the uterus starts bleeding a lot, then it can ultimately compromise perfusion of the baby. So we use a special tool where you basically, let me see if the next picture shows that. Not yet. Okay. So basically make a little incision, and then with the little incision, you basically kind of try to tent up the space, and then use this special tool that you clip on, and it puts staples across the walls of the uterus that stops it from bleeding. And then you could go ahead and deliver the baby's head, have the neonatologist intubate. If there's difficulty with intubation, pediatric surgery jumps in to secure that airway, and then I deliver the rest of the baby. So I got the baby out nicely. Everything worked out beautiful. You could see the neonatologist went ahead. Remember, this baby is still connected to the placenta, okay? And the rest of the baby's body is actually still in the uterus, so still intrauterine. So it was secured, so you could see it right here. So you see the mass right there. So this was the big mass underneath the tongue that was occluding the airway, okay? And then ultimately we are closing. So I had a video here, but I don't know how much time I have. If we have time, I could play it later. That kind of basically shows it. But ultimately we're able to get this baby out safely. They resected the tumor, and the baby is doing just fine. I actually got a chance to see the baby before I graduated. So all that stuff has happened. It's been 17 years later of training. So the 4 years of college, 2 years of master's, 4 years of med school, 4 years of residency, and 3 years of fellowship. And here I am, finally joined a practice in Ohio a year and a half ago. This is the rest of my team, all maternal-fetal medicine doctors. Now my day basically is I come in the morning, I go upstairs, I round on our patients on antepartum, so all our complicated pregnancies admitted. And I come downstairs, I read ultrasounds, I do consults on complicated pregnancies, I make plans for general OBGYNs to manage their patients. Some weekends I take calls, I deliver babies still, some of my partners don't, but it's something I love so much. I have my surgery days where I do procedures such as sucklage. I actually have one tomorrow morning at 11:30. So women who are at risk of losing their pregnancy, I'm able to put a stitch around their cervix to get it sealed and carry the pregnancy as long as possible. I also do little fetal procedures, like a quick one I'll show you. I'll just go through it real quick. So if you guys see this video right here, so this is a fetus at 26 weeks and 5 days. If you look at all the black area around here, that's all fluid. So this baby has fluids in multiple compartments. And in these multiple compartments, you basically are dealing with what we call hydrops. And in hydrops, you're talking about multiple reasons why it could happen. But to make it nice and short and sweet, you basically have a mom who is ROH negative, okay? And this mom also is has a history of IV drug use. She has had a pregnancy prior that was complicated by what we call isoimmunization, meaning the antibodies in mom is attacking the baby's red blood cells, and which can ultimately lead to hydrop. So this happened before. I happened to randomly meet her in the emergency room because she came in with urinary symptoms. One of the residents put an ultrasound on and saw this. And so I coordinated everything. Ultimately, we were able to do what it's called. So I got her in the same night I saw her, I had her transferred to our other hospital, and 7 a.m. the next morning, I was doing this procedure. And this is basically called Intrauterine Transfusion. So this baby was so anemic from all the red blood cells being destroyed by the mom's antibodies. And so I was able to go in with a needle on ultrasound guidance, going with a needle directly, okay, into the baby's umbilical vein and transfuse blood. Basically, it's a blood that is typed, make sure it's clean, it's radiated so that no antibodies are making its way into it, and transfuse the baby. And I ultimately did 3 separate transfusions on different days on this baby, and this baby recovered completely, ultimately was delivered around 36 weeks and did just fine. Now, these are the kind of babies that normally will die without anyone knowing exactly what's going on. But we have procedures like this that we are able to do. We also have procedures like, if you guys have heard of twin-to-twin transfusion syndrome in monochorionic twins, where one baby is basically taking blood away from the other baby. Maternal-fetal medicine doctors can go in with lasers. One of my partners here in my practice now actually does this, can go in with lasers and can cut off all the abnormal blood vessels so that you could have both babies survive. I mean, it goes on and on what we could do. So we are surgeons, we are radiologists, we are medicine doctors. I mean, we do it all as long as it has to do with pregnancy. So that's my life now. It's a long journey, but personally, I think it's been worth it. And if I had to do it all over again, I would do exactly the same thing all over again. So thank you guys for listening, and let me know if you have any questions.
Thank you so much, Dr. Nwabuobi. That was a wonderful presentation. We get a lot of questions, so we'll get right into it.
Yes.
So could you just go a little bit more about like what your everyday life looks kind of like? You know, you mentioned different procedures, but if you walk us through like maybe a week then?
Yes. So so the hospital I work with is basically affiliated with Ohio State University. So I'm actually an adjunct faculty at Ohio State University, but I'm in one of the big health systems here. So the OBGYN residents at Ohio State University spend about 50% of their time in our hospital system, and then the other 50% of the time at Ohio State University. So like I said, I come in the morning, and basically I see what's going on the ultrasound unit, our maternal-fetal medicine clinic. Usually I read some scans, talk to some moms who have high-risk pregnancy. Now, high-risk pregnancy, I'm talking to like moms with blood pressure issues, diabetes, thyroid. You're talking to moms who have, like, right before I started this case, I was going over with one of my partners about a mom who possibly has what we call placenta accreta. And you have placenta accreta when you've had multiple C-sections, and now the placenta starts burying into the wall of the uterus. okay, it's very difficult because in those cases, you can actually end up with having a hysterectomy done right after the baby's delivered. So you need to know to plan for that surgery before it happens, because you need blood products. I mean, people lose up to 20. I mean, the highest I've seen is 23 liters of blood lost, 23 liters. I mean, that's massive. So,
Yeah.
so we do that. And then I usually, like I say, go upstairs, see all our moms on the antepartum service. So antepartum are moms who are, it's not time for them to deliver, but they have some issue going on. Like I have about 4 people upstairs right now with COVID who we are managing. Then I have one mom who presented with bleeding, who we are monitoring. I just recently discharged mom with previa, where the placenta is covering the opening of the cervix internally. And so any little thing, because I mean, you could list complications. I mean, once you start getting into this, you could see why we cannot have enough OBGYNs in the country. Not to talk about enough maternal-fetal medicine, but my days are very different. Every day, very exciting. Some days I have procedures to do. Some days I'm not planning for procedures and it comes up and I have to do it. But yeah, I hope that kind of give a little bit of a picture.
Yeah, thank you so much for answering that. Kind of a follow-up to that, we just got a question. Have you been seeing any pregnancy complications recently due to COVID, either because of the virus or because of expecting mothers not coming in for needed visits?
So, so far, one of the things I try not to, talk about too much, especially to like family and friends, is, the COVID and pregnancy, just because I know some of them are, thinking about pregnancy and all that stuff. But I've taken care of a lot of pregnant COVID moms. The one thing I would say about COVID and pregnancy is that most of our moms are doing very well. There's something about pregnancy that seems to be very protective. Part of my fellowship was I did 3 years of basic science research and fellowship. And what you come to learn about pregnancy is that for pregnancy to actually happen, there is this anti-inflammatory state the body has to maintain. And guess what? COVID is inflammatory. Pregnancy brings this anti-inflammatory state. So a lot of our moms actually do well. Some of the people I've had difficult time with has been moms who have comorbidities. So our moms with hypertension, our moms with morbid obesity, those are the moms who's been difficult managing. But for the most part, knock on wood, all the moms have ended up going home just fine. One I have right now is kind of dragging it out a little bit. We've done steroids, we've done remdesivir. Tomorrow is her last day of steroid. I'm hoping things turn around, but she's slowly progressing. But for the most part, it's been ultimately mostly good news with our moms.
That's really reassuring to hear. Thank you for sharing. If you're willing to answer one more morbid question, with maternal mortality rate as high as it is in the US, especially for non-white women, what do you think needs to be done at a medical and a community level?
Yeah, so it's a multifaceted thing. So I think first thing first is, and I'm a big proponent of this. I think we need to start re-emphasizing preconception counseling, meaning that there's a lot of, we know in the country, 50% of pregnancies are not planned, okay? It's the truth, right? And it's probably gonna take a while before things change. But 50% of pregnancies are not planned, meaning that 50% of people who get pregnant, they might have some medical problem that was not addressed before they got pregnant, but here we are, and now we gotta deal with it, right? So if we can focus on targeting patients when they come for those regular annual visits and say, hey, are you thinking about getting pregnant in the next, year or two or something like that? Hey, why don't you go talk to, or why don't we have a conversation? An OBGYN can have this conversation, and MFM gets involved if they have a complicated history to try to address, some of those things. Number 2 is this. A lot of the neighborhoods, a lot of the patients that we are talking about that are affected the most by maternal mortality. So you're talking about, people of color, African Americans, Hispanics. When you think about it, look at the healthcare workforce, right? What does it look like? Currently in the United States, only 5% of the physicians are African Americans, right? Now, within that 5%, okay, I don't know if the numbers have suddenly increased, but if it increased, maybe it bumped up 1%. Okay, now within that 5%, now think about it, that's 5% only, right? But look at who the patients are. And there's been several studies that have shown that the interaction is significantly different when, African Americans interact with a physician that looks like them. I don't think it's necessarily because the physicians are much smarter than, a physician of a different race, but I think it's more because there's that interaction you could have with a patient, the vibe that you kind of have with the patient that someone else just cannot recreate. You say no to the person, you're not going to take your insulin. I walk into the room like, sis, listen, you need to take your medication, right? It just sounds different. Like it's just a whole different distance where they're like, all right, doc, I'm going to take the medication. It's just different. And there are certain cultural, things that someone else might not connect with the patient that I could come into the room and connect. I'm also blessed that where I work, I actually have a lot of patients from West African countries. And I have my partners who will go into the room, have the conversation with them, and they're like, nope, we're not doing it. I walk into the room, I switch it up, and before you know it, they're like, all right, when can I start? So I think that connection is lacking. The other thing is that in a lot of neighborhoods, like I noticed what's happening is a lot of hospital systems are shutting down hospitals in a lot of inner city neighborhoods and then moving them to the suburbs. What do you expect is going to happen when you do that? Obviously, they go into the suburbs because they're chasing after the good insurance. But then what happens to those neighborhoods where you do not, where you do not have the healthcare providers anymore? What's going to happen to them? How are they going to make it to the appointments? How are they going to catch the bus? How are they going to? So it's a multifaceted answer, and that's something that we could have like a 4 or 5 hour conversation about, because, I have my own view about it, but it's going to require every single one of us to work together to fix this, because it truly is a big problem. And it transcends beyond class and education and finance. So it's a very important question.
Mm-hmm. Thank you so much for answering it. I agree. I saw a lot of nodding heads around in the Zoom room, so you definitely resonated with a lot of people here. We do have time for one more question. I saw Michelle, you have your hand up. If you want to come on mic, you can ask it.
Hello. Hi. My question is, do you ever have a case or seen any cases regarding to conjoined twins?
Yes. So let me give you guys a quick education right now. So how do we form conjoined twins? Hopefully you guys appreciate what I'm about to tell you. So with conjoined twins, so there are two ways to have, you guys know, everyone is always talking about, do your twins look alike? Or, versus the twins who don't, are they fraternal, right? Like those things. So think about it. This is the way we get to conjoined twins. And then I'll answer your question directly. So when you have one sperm, one egg from an embryo, right? Depending on what day the split happens, tells you the kind of twins you have. Okay? Now, di twins are the ones that are fraternal, where everyone is like, they don't look alike. It could be a boy and a girl, okay? It could be boy, it could be girl, but mostly you don't go off of the sex. And that's because it's 2 sperms, 2 eggs, right? So let's put those guys to the side. Now, if you have 1 sperm, 1 egg from an embryo, okay? Now, if you're talking about, depending on when they divide, okay, you could have di, okay, twins. You could have your monodi, okay, where they have, so with the di, they have 2 sacs, 2 placentas. With the monodis, they have 2 sacs, 1 placenta. With the mono, 1 placenta, 1 sac. Now, the guys, the embryo that decides, you know what, I'm just gonna take it easy and divide day 13 and pass, then you can end up with conjoined twins. Okay, so remember, 2 sacs, 2 placenta, 1 sac, 2 sacs, 1 placenta, 1 sac, 1 placenta, 1 sac, 1 placenta, but now they're conjoined. So yes, during my training, I'll say I saw about a total of 4. 1 I remember clearly, just because in this case they were sharing 1 liver. They had 2 hearts, but they were sharing a liver. Okay, so they were connected at the level of the abdomen. And this mom decided, or she read up, or she was part of a blog, and wanted someone to operate on them to take care. So she came to us, but things started looking a little bit more complicated than what we thought once we started doing MRIs and all these different things. And then she ultimately, I remember she ultimately transferred her care to another health institution because someone had told her that they could operate on it. But our surgeons were very worried that that was not going to work. But yes, that is something we see. The truth is that most of the ones, the other ones I saw, the parents, just because of how complicated and how much things they were sharing, the parents decided not to continue with the pregnancy. But yes, that is something that a maternal-fetal medicine will be taking care of.
Wonderful. At this time, we are about to wrap it up. Do you have any final advice for our students?
Yeah, my final advice is don't give up. You know, there's so much pressure on this generation, but I also think this generation is also one of the most promising. Just seeing what you guys have been able to put together here is it's just amazing, because this is, I see you guys are passionate about what you're doing. Just the coordination from the interaction I had, you guys are so organized. Everyone is like, it's so like well-oiled machine. Everyone knows exactly when to beat next. It's awesome. But I see that also translate into the passion you guys are going to use to transform healthcare, no matter what it is you are doing. Okay, today I'll just run through my family for you. So I'm a physician. My brother is a nurse practitioner. My sister is a physician. She's a movement disorder specialist, so neurology. My other sister, she's in social work. And then my little brother is a nurse. Okay, all of us went into the healthcare field. But you know, sometimes when all of us sit together, I'm married to a nurse who's actually completing a nurse practitioner program. So we are all surrounded by medical people. But one thing we always talk about when we all get together is that there are so many ways to get to this, okay? And it took every single one of us different ways to get there and different lengths of time to get there. But it doesn't matter. It's not a sprint. I don't even think it's a marathon. Just take your time, do it right. Don't let the pressure of another person who already got accepted get to you. You will get there. Just continue to be consistent in yourself. Continue to be passionate. Make sure you are living a full life. Don't live a life that is only geared towards getting this acceptance. You will not enjoy it. There is more to this life than this actual career. Build yourself as a person, and I'm telling you, the right people will notice you. Real quick stuff. One of my best people in the world right now, actually, I'm going to talk to him after this, is a good friend that I met during fellowship. He is an interventional radiology. He was an interventional radiology resident when I met him. And I noticed he was like a little older, but he looked, you know, a tall guy. He works out. You cannot really tell, you know, his age. It turns out that he actually was the scrub tech in our OB labor and delivery for many years. And at one point he said, you know what? I want to be a doctor. At the age of, I think he was like 37 or so. He said, I want to be a doctor. He applied the first time, they said no. They said, dude, you need to go retake some of these college classes. He graduated with like a GPA of 2.2 in college. He went back to college and retook all these classes. Remember, this is the labor and delivery scrub tech. He came back, he applied the next time. They're like, okay, we'll think about it. He went to the office one day. He's like, guys, listen, I really want to do this. This is my passion. I've been the labor and delivery scrub tech for how many years? And then finally, one guy gave him a chance. This guy graduated top of his class in medical school. Okay, he was actually the valedictorian. He did interventional radiology residency. He was the first class, because that's kind of a newish specialty by itself. It is an interventional radiology fellowship. He finished. He is doing a neuroradiology fellowship now. And then when he's finishing that, he just got accepted into an interventional neuroradiology fellowship. So he's going to graduate at the age of 50. That is passion. He has 3 kids, grown kids. That is passion. So do not give up, guys.
Wow, thank you so much. That was such an amazing presentation, such an inspiration to all of us. And I just really appreciate you taking the time out of your day to join us.
Thank you.
For all of our students, I do have some information for you guys. Let me know if you can see my screen.
Yep, I think you're good now.
You guys see that? Awesome, perfect. Thanks, guys. So just some important information. We do have a lot of students on this call right now. If you guys go to take the quiz and you have any technical errors, I recommend logging out, getting off of the website, and trying again in an hour or two. The thing that I discussed earlier, we are a student-led nonprofit organization and do not have the funds at the moment to upgrade our website server. So we can only hold a certain amount of people. Once we bypass that, it starts shutting down, you guys will have complications with your quiz. We have given you all 2 tries to get over a 70%. So if you miss out on the first time, you guys still have your second try. You guys can still do that. The quiz can be found on our website, and I will go over how to get your certificate at the very end. So just as this is virtual shadowing, this is not something that you have to turn in to prove that you were here or anything, but this is just something for you, kind of reflect. You joined us today. What reasons did you join us for? That's part of your why. Why are you here today? What part of today's presentations resonated with you? And what are 3 key takeaways that you are going to take from today's presentation and take with you for the rest of your life? These are all super crucial things that you guys should be thinking about, and it'll help you in the future, when you're writing your personal statement for your med school application, you can really go back and take a snapshot of your brain and see exactly, how you were feeling, what you were thinking after, joining us in our virtual shadowing session. So just some stuff to keep in mind. Like I said, you don't have to turn this into us, but if you are interested in potentially getting published on our website, you guys can submit this on our website, prehealthshadowing.com/blog submissions. You can submit this reflection, and we put the link in the chat. We are a student-led, student-run team. If you are interested in joining our leadership team, you can apply on your website. This is a 100% remote opportunity where you have the chance to meet with like-minded students and professionals, gain professional experience and skills in other domains that will benefit you for the rest of your life. So check this out if you're interested. Go onto our website. We understand that you guys are all pre-health students and time is not something you carry in your back pocket. If you are too busy right now and you still want to get involved, we are more than happy to have you. You can volunteer on your own time for as many or as few hours as you can. And we do have asynchronous volunteering opportunities available. You also can collaborate and work on hands-on opportunities. So if you're interested in getting together with a group of students from around the world and potentially making a video project, or sending out PR messages or writing grants or anything like this, you can even start your own study. So if you guys are interested, be sure to sign up as a volunteer on our website. We have lots of great things. Another cool thing with this is, as we are a student-led program, you guys can submit your own proposals for projects that you'd be interested in leading, and you could potentially be the leader of your own project. So how cool is that? You guys can do all of this. Check out our website. Like I said at the beginning, if you missed out, we do have a mentorship opportunity happening on February 19 to 21, where you have the opportunity to meet with up to 6 established professionals. This is by invite only. So to get an invitation, you're going to want to click the link that Hannah just sent in the chat. You're going to download all of the materials from our Google Drive. Once you get $136 from fundraising, you can submit your bingo board and you will receive an RSVP link to our mentorship connection day. Super easy. All of the instructions are on our website on that link. You can also find it if you just go to pre-health shadowing. It'll be on the side. You can click it and you'll have all of the information there as well. Be sure to tag us on social media at Pre-Health Shadowing and use the hashtag Pre-Health Shadowing whenever you do anything cool. We would love to hear about it. We really do support our students. So be sure to, tag us in it. We'd love to see what's going on. All right, this is a different QR code than I presented to you at the beginning of today's session. This is to actually join our fundraising team. So we are a student-led nonprofit organization, and we support students in any domain in healthcare across the world for completely free. It costs nothing for anybody. So we are asking all of you guys to please send out this fundraising link. This is to join the team, and you can track how much money you have made for pre-health shadowing, which is really awesome. And we also can give you volunteer hours for this. So if you are looking for virtual volunteering hours, this is a really easy way to get them. You just send out the link, and we are working to fight against inequity in health education and promote diversity in the various fields. So consider joining pre-health shadowing as a volunteer, and we have a bunch of different things that you guys can get involved in. We do have upcoming sessions. We have a full week of shadowing for you this week. You can sign up on our website, prehealthshadowing.com/sessions. And last but not least, this is how to get your certificate that verifies your virtual shadowing hours for joining us today. You are going to go to our website and click on all shadowing sessions. Once you find our professional for today, you are going to click free take this course. Once you do that, you will have 30 minutes and 2 tries to get over a 70% in the post-shadowing assessment. As soon as you get a 70%, whether it's your first or second try, go ahead and click finish course. Then you can download your certificate immediately, or you can always find it in your profile in the certificates tab. If you guys have any questions about this or experience any technical difficulties, like I said, log off, try again in an hour or 24 hours. The video will be posted and uploaded to our YouTube within 24 hours of today's session end time, and it will be on our website within a week. So if you guys want to rewatch the video, feel free to take your post-shadowing assessment. We appreciate all of you guys joining us for today. This is the end of the virtual shadowing session. I invite you to disconnect from the call.